couple of months ago, many of us arrived in the city of Melbourne to the terrible news that several colleagues were tragically lost aboard Malaysia Flight 17. Among them was Dr. Yup Langa, a global leader in our efforts to control the HIV epidemic with antiretrovirals, a former IAPAC trustee, and a good friend to us all. In an eloquent and impassioned speech at AIDS 2014, our keynote speaker today paid homage to Yup and pleaded with us to continue his activist legacy by bringing all of our passion and energy to a new vision, ending the AIDS epidemic by 2030. As you will hear this morning, Michel Sidibe exemplifies the vision, passion, and energy requisite in leading a global effort around which we must all play a role, together fulfilling a prediction made by Yup not too long before his untimely death: an AIDS-free future is possible. Since his appointment as Executive Director of UNAIDS and Under-Secretary General of the United Nations by Secretary General Ban Ki-moon in 2009, Michel's vision of zero new infections, zero discrimination, and zero AIDS-related deaths has echoed around the world. Under his leadership, UNAIDS is working to ensure that no one is left behind in the response to HIV and that everyone in need has access to life-saving prevention, care, treatment, and support services. As he heads to New York City for the UN General Assembly, I know that he will use his inimitable charm and powerful advocacy to ensure that the world's political leaders recommit to making the resources available for us to make new HIV infections and AIDS-related deaths exceedingly rare. Before he delivers his keynote address, I asked him to please join me up here for a humble presentation of a very small token of our appreciation. Michel, this is to remind you of how much we value your contributions over so many years, and that we are with you in spirit next week as you represent millions of people living with and affected by HIV/AIDS. We recognize your tireless leadership in our quest to end AIDS.
Thank you very much. I'm very touched. Thanks. Thanks a lot. Thanks. Thank you very much, dear colleague, dear friends. It's always a pleasure, a privilege also for me to have this interaction. It is the second time that I have the opportunity to be with you. And I want to say that today and tomorrow meeting will be a very important one. It's important because it is timely, and it is also topical. It is timely and topical for the simple reason that leveraging HIV treatment to end AIDS is today we should start doing that or we will fail. So it's timely. It is topical because also if we want really to make that happen, we need to know that it will not just about treatment for the sake of treatment. It is not just about giving pills to people. It is about also changing completely our perspective. Is moving from pills to dignity of people. Is looking on new delivery system. Is thinking about people who have been left behind, but is also bringing this transformative agenda to reduce new infection. But more than all of that, it is what you have been mentioning, how we deal with the cost of delivery our services to people who are in need. And I want to say thanks to IPAC. Thanks to you for, Jose, for your leadership, for bringing all those key people in this room. Minister of Health from certainly two key countries in Africa, Malawi and Swaziland, and also bringing civil society can live with us, and also Debbie Birds, my friends from PEPFAR, and all others constituency, people coming from different places for pushing the science behind all the things we are doing. Without those groups, we will never be able to achieve what we want to achieve. And I am happy to say that it's not just this group who will certainly help us to articulate, but it's all the people who are outside there, people who are not in this room, who will make sure certainly that our ideas will reach people in the ground. So shifts need to happen. The first shift I want to talk about is certainly how we will be more closer to people, how we will bring a new delivery approach, which will be certainly calling for a community approach, which will change completely innovation which is existing today to make sure that we can have a new tool which could be owned by people down there. If we don't democratize the access to services, if we don't democratize the knowledge to make sure that people can own it, it will be very difficult for us to be able to say that our services will be completely able to scale up and be sustainable over the years. So for me, the first thing is to reflect on our delivery approach. The first thing is to change completely this paradigm, which is too far. And Ebola is showing that clearly to us again after our experience with HIV, that when we are not, we don't have this proximity, it will be very difficult for us to reach people in need, and we'll continue to see more and more people left behind. So let us reflect on that, and it is a critical moment today. Is we are in a defining moment and in our campaign to end AIDS. And this campaign to end AIDS will need certainly a new paradigm for delivering services. That's one. The second one I want to push on is that it's very important for us to be able to use science. Science is with us, certainly pushing us on, but we need to be smarter. We need to know how we will really make this science available to people who are not necessarily in this room, who will be in need of translating that into what I call implementation science. Because if it remains only in those nice documents, and if it's not owned by people who are implementing, it will be very difficult for us to translate our great ideas into something which, and to do that, let me say something which I personally feel is very key for us, is to certainly foster the link between social change and science. I think evidence is there, but if it's not owned by society, if this transformation is not owned by communities, it will not happen. We saw that in so many occasions. If you take the example of circumcision, you are taking even the example of condom use after so many years. If it's not owned by the people, if you don't foster the link between social change and science, it will not happen. Your science will be there in one side. It will be clear evidence. We can say that we have a reduction by 66% if they are circumcised among young men, but it will not be used. So this is, for me, how we democratize again, how we make sure that we make the link with social change with what we have as an element of science. And that is very important. And for me, that is important also that we talk about innovation. Innovation is critical. Whatever we have been able to do today is because we have been partnering with people. It could be pharma, it could be other groups who have been able to give us the tools, the medicine, the drugs, and produce certainly drugs which could be more effective. And we need to start thinking about also these long-acting drugs, thinking about transformation in tool which can protect young women. So we cannot continue to believe that we'll control the epidemic if we don't work with those group of people who are there putting their resources for innovation, but which innovation we need to have and to reach whom, where is the important question we need to push here together. That is bringing me to the ideas of 1990. 1990 is not just, from my point of view, again, a magical numbers, numerical numbers, telling to the world we need 90% of people tested, 90% of them being put on treatment, and 90% of them with viral load suppression. That's sad, but what is about 1990? 1990 is about a shift from whatever we have been doing from disease to put people at the center of our approach. 1990 for me will never be successful if we don't have a human right at the center of our approach. 1990 will never be successful if we don't have the possibility to fight stigma, discrimination, changing completely the paradigm and bringing people who have been left behind. And for me, that is a new way for the first time to have a single target with 3 cascading targets, so which was not existing. And it is the first time we can say by pursuing treatment, what we want is equity. It is not just to demonstrate that treatment is working, but what we want is to be able to demonstrate that it will be, equity will be at the center. Redistribution of opportunity will be critical for us. But 1990, let us be realistic. If we want really to make that happening, what we need to do differently. The first things I personally feel is, I was saying that to both ministers yesterday night, it is not again a call for saying, let us go everywhere. Let us do everything. Let us test even when we know that it is not cost effective. What I am saying, we need to saturate. We need to prioritize. We need to make sure that our resources will go where we have the maximum of a new infection, where we will have more people treated, where we will be sure that we will suppress the viral load of the maximum of people. If we don't do that, we'll put a lot of resources and we'll lose time. In 2020, we'll not be there. Why I'm saying that is all the saying is not coming from me. People, and I heard Hillary Clinton saying that, why rob banks? It's very simple. People are going there because money is there. So if we want to save life, let us go where infection is. Let us go where we have a maximum of a number of people in need of treatment today. If we don't do that, we'll put a lot of energy. We'll put a lot of effort without having return on our investment. So that will bring us clearly to think about our strategic information. If we don't have a new way to package strategic information, revolution in data, using all the technology we have to make sure that we have a best tailored information for investing, we will not be there. It is so clear for me that today information is very fragmented. We don't have necessarily the best information to know where we will put our resources to have a maximum of return. If you take the case, I can just give you a simple example. You talk about epidemic in Africa in general. People will say, oh, southern part of Africa. You talk southern part of Africa, people will say, oh, South Africa. And you talk South Africa, people will tell you KwaZulu-Natal. If you start having a proper strategic information and data. When you look at KwaZulu-Natal, people will tell you even Durban. So if we don't pay attention to where we need to saturate, where we need to make sure that our testing program will be the most effective, where we will have the greatest number of movers who need certainly to be tested and to know where we can reduce the transmission, where we can put people on, we will not be there. So let us be courageous to say that 1990 will be a success story for all of us by 2020 if we are capable to rethink our strategic information, if we are capable to better target, to prioritize, and to put resources quickly where it is. And we were discussing that with Minister of Swaziland yesterday night, with Minister of Malawi. I think we need to support countries to go in that direction. And it will help a decision maker to think differently, to be not overwhelmed, to not feel that we are telling them to go everywhere, but to know where they should really, of course, continue to advocate, to have policy reform, to make sure that their strategy for stopping primary infection and continuing with the prevention program, but where they need to put the bulk of their resources to demonstrate that they can control this epidemic. And that is very important if we want to really win on that one. So track the epidemic and gaps across treatment and prevention cascade. That is very important. Analyze the trend. Make sure that we have more specific information and we know the patterns of this epidemic in different places is key for us. And of course, is important for us to be able now to have scenarios to demonstrate that what could be where we need to put more effort in terms of addressing the different issues in function of different regions. You cannot believe that you will win in southern part of Africa without putting your resources on young women. You know that it will not happen. So it's not just about areas where we need to put, but it's a location and population. If you're in Eastern Europe and Central Asia and you don't want to put your resources on people who inject drugs and others, you know that it will not happen. You will not control the epidemic. So it's one side, of course, is important for us to have a location to better understand where we put our effort, but we need also to link that to population analysis. And for me, having a clear monitor, markers, and to be able to evaluate progress regularly with our countries will be key. So for me, it is a high time to liberate what I can say, the data, avoiding the temptation to varnish it for self-serving reasons. And that is very, very key for us to come together to really have a clear understanding of strategic information and how we use that. I think talking about location, I want to just to pay attention to a growing phenomenon. And you don't need to really travel a lot to realize that we are seeing a huge movement towards cities. Most of our countries will have more people in the cities. And cities will become certainly the centers of a new emerging epidemic. Cities will be also the place where we will have to reinvent completely our way to reach people. And if you look at what is happening today, out of 220 cities, we have, I think, almost, I can say it, with 220 cities selected, we have almost more than 50% of new infection happening on those cities. So if we don't think about what will be our next generation of approach, how we'll put cities at the center of our approach, it will be very difficult for us to talk about what we are mentioning in our GAP report, people left behind. Because most of those children and adolescents, young women, man having sex with man, prisoners, sex workers, you will see that most of them are unfortunately facing criminal laws or being certainly excluded in those cities. And it's key for us to start bringing the debate in cities. And cities are more flexible. And cities will certainly be the place the new governance on health will start being discussed. Cities is certainly the place where we will have a new democratic movement in terms of reaching people who are not rich with services today. With a more flexible budget, with a more certainly flexible systems to be able to reach those. And we are seeing already a movement. You take New York City, and we're trying to say already that they want to end the epidemic by 2020 in New York City. We are seeing other cities coming more and more. And we want, with IPAC, UNAIDS and IPAC, to really partner in the AIDS-free city initiative. We think is critical one. It will be also an opportunity again to test this location and population approach and make sure that we accelerate the ideas of 1990 in cities. We have Vancouver, good example with Julio. And to help us to move on this, I put in place, under the leadership of Julio, a STAC, which is a scientific and technical advisory committee with the French people will say la crème de la crème. So I don't know in English, the creams of the cream is the same. So people to come together to really, is a family, to advise me, to help me to take the right decision, and to think about how we can really translate this 90 into actionable plan or ideas which will help us to support the countries to really accelerate and quicken the pace. So for me, that will be also key for using cities, trying to think, test different ideas, but it will be for us indispensable to achieve 1990 if we don't try to move from this generalization, going everywhere, trying to do everything, but focusing on where we will have a maximum of return. I'm convinced on that. Believe me, and Chiefs is with us here, when I started to talk about 22 countries in UN, and he's from UN, even if he's not in UN, so we started in UNICEF together. But 22 countries by saying, let us select the 22 countries where we have the maximum of babies born with HIV. It was a huge problem in my board. Huge problems because we are not used to that in UN. UN is about 193 or 94 countries, and everyone, and we need to do everything everywhere. And we would have never, for years, we're talking about how to reduce the number of new infections. I started the first program of UNICEF in Uganda. Times back, I was very young. But still we are talking about. But when we had the decision and we took the courage to say that let us go first with these 22 countries where we have more than 95% of babies born with HIV, we changed completely the dynamic. First, we changed the regimen. We managed to really make sure that we move from nevirapine to more effective regimen. Two, we had the privilege to have Malawi introducing B+ when nobody wanted to hear about B+. Today, we don't even discuss that. And we are saying we reduced by more than 50% the numbers of babies born with HIV. And we are talking about possibly to achieve this generation free by 2015 if we are capable to win in Nigeria. So I think let us be honest. If we want, again, to win on 1990, if we want to save maximum of life, if we want to control the epidemic, which is the word, to control the epidemic, let us not miss to put our resources where we have a maximum of people in need of treatment, maximum of new infection. If not, we'll miss again the opportunity to change completely the course of this epidemic, and we will probably miss to show that the window of opportunity we are having, and for me, is very critical to say that it is the next 6 to 5 years. After 2020, I don't believe we'll have the same chance. If we miss the opportunity to quicken the pace, to accelerate, to fast track, to make sure that we demonstrate that we can control, I am sure that the chance to reach, to end the epidemic in 2030 will not be there. And I hope to govern, and I'm happy 20 by 20, whatever we can do. I don't have a problem. It's not a numerical target. Your effort will contribute to 90 to 90, the effort of others. But let us, again, focus. I hope I pronounce the word focus correctly. And that is and I want to say again, thank you for your support. Thank you for the work you are doing. And it will be our greatest gift to the generation to come to really be able to say that we have been contributing to great things. We have been able to govern to really end this epidemic by making sure that it is not anymore a public health threat in any places. Thank you very much.